And thank you for joining us for this Monday's press briefing. Today, Orange County Mayor Jerry L. Demings will discuss our goals for the week, new testing sites, an important announcement on CARES funding, eviction diversion information that is helping families here in Orange County, and an update on census and more. Orlando Mayor Buddy Dyer will discuss COVID precautions and activity in the city of Orlando, other important safety measures the city is taking, and assistance for businesses in the city. From the Florida Department of Health in Orange County, Dr. Raul Pino is here. Glad that he's here today with important updates on COVID-19 trending here in 19 and other quantitative data. And Comptroller Phil Diamond has joined us as well for an update on tourist development tax collections. We begin this Monday press briefing with Mayor Demings. Mayor.
All right, thank you, Dr. Williamson. Thank you to all of you for being here this afternoon. As we begin today's press event, just want to remind you that we now have had 75 different news conferences since March regarding the novel coronavirus. I want to welcome again the County Comptroller, Mr. Phil Diamond, who will update you on the tourist development tax numbers for the month of August. We are slowly lifting ourselves out of the pandemic, at least the economic crisis associated with the pandemic. Each week I endeavor to talk to you about the goals that we have for the week, and there's three primary goals that we have this week going forward. Number one, we want to continue to offer free testing to Orange County residents, and we'll talk more about those testing sites. Number two, we will continue to offer crisis assistance to individuals and families. I'll be making an announcement in just a few minutes about those plans. And number three, we will continue to slowly reopen Orange County facilities as our coronavirus numbers stabilize. As for the total number of COVID-19 cases in Orange County, there are now a reported 41,055 positive cases. That is an increase of 112 cases since yesterday. Let me try to put that number into perspective for you. If all 41,055 positive cases represented one resident, that would mean that about 3% of our population would have tested positive for the novel coronavirus so far this year. Since Friday, which was the last time we did a press briefing, we now know that our president and the First Lady have tested positive. That should point out to you that we must continue to respect the potential for the spread of the virus as well as the lethality of the virus. We have documented 483 Orange County residents who have died from the virus. That's an increase of 4 deaths from the weekend. We always want to take a moment and remember those whose lives were claimed by this deadly disease and the heartbreak their loved ones are enduring. Our 2-week positivity rate is 4.4%. Our average since the beginning of the pandemic in March is 11.4% cumulatively. That is still below the state average of 13.25%. Orange County Health Services has consistently offered free COVID testing every week in different locations around the county, and we will continue to do that this week. The team will be at the Mexican consulate tomorrow from 8 a.m. to 1 p.m. This testing is open to everyone. Anyone desiring to be tested can go to 2550 Technology Drive in Orlando, which is the location of the Mexican consulate. Wednesday and Thursday, health services from Orange County will be in Apopka at Kelly Park from 8 a.m. to 1 p.m. All those 12 years old and up can be tested with parental consent if they're underage. Also, I want to mention the state has announced that the Orange County Convention Center testing site will no longer offer antibody testing. As I mentioned at last Thursday's news conference, with the news of so many county residents losing their jobs, there is a pressing need to help those affected with rent and other household expenses. So I'm going to announce that We will continue to offer dollars through our Families and Individual Crisis Assistance Program. So far, we have allocated, invested nearly $30 million to approximately 30,000 households. We will continue to do that with another round of $30 million that will be made available through our Orange Cares for Individuals and Family Assistance Program. The program will provide a one-time payment of $1,000 per household for residents affected by COVID-19 to help bridge financial gaps. At this time, it is important to note that residents who have already received funding from the Individual and Family Assistance Program are not eligible for this round. The application portals will open on 2 different dates, Monday, October the 12th at 8 a.m. and Saturday, October 24th at 8 a.m. Some main points we would like to stress for our residents is only one person per household can receive funding. That means if there are multiple people living in one household, only one person in that household can apply and get funding. For each portal opening date, it will close after 10,000 applications are taken. Duplicate applications will be denied. You cannot use P.O. boxes to apply for the funding. You must use a physical location where you reside, and you cannot use a family member's address. If any residents were denied by the CARES programs because of duplicate applications or other issues prior to the reopening of the portals, they may reapply if discrepancies were resolved. Frequently asked questions will be posted to give guidance to applicants. Updated information will be posted at our website at ocfl.net/orangecares later this week. Please stay tuned for additional information. Let me talk a little bit about our eviction diversion program, which launched a little over 1 month ago. So far, we have approved nearly $700,000 in payments that will allow 209 families in Orange County to stay in their homes and avoid eviction. This is a program where both the landlord and tenant must jointly apply for relief. Funds are available, and you can find more information on how to apply by going to our website again at ocfl.net/eviction diversion. Back in March, Orange County government launched our COVID-19 rental assistance program. The program was funded from general fund dollars prior to receipt of any federal funding. Our plan was to help 1,500 families pay 1 month's rent, and we had $1.8 million allocated for this program. I'm happy to announce that we exceeded our goal. We helped 1,608 households and paid almost $1.84 million in general fund revenues to help families. Our Orange County Parks and Recreation is announcing a phased reopening for our picnic pavilions, adult athletics, splash pads, and group camping effective Saturday, October the 10th. Please note there will be limitations on the number of people in pavilions. For our splash pads, they will be at 50% capacity. Also, indoor facilities and outdoor basketball courts will remain closed for now. Swimming at Kelly Park and Fort Gatlin Recreation Complex will also be closed, while there are renovations occurring at both of these locations. Further information on the reopening of these facilities will be forthcoming. Again, you can get information about our park hours at ocfl.net/parks. We do have our parks director, Mr. Matt Studemeyer, who's here this afternoon, should there be any additional questions. And finally, just as a reminder that due to a legal challenge, the deadline for the 2020 census has been extended to October 31st. Originally, the deadline was September the 30th, and then, of course, it went to October the 5th. Now it's October 31st. That will likely be the final date to submit your census information, October the 31st of this year. You can get information by going to my2020census.gov, my2020census.gov. And at this time, I'm going to turn it over to Mayor Dyer.
Thank you, Mayor Demings. So it wouldn't be a COVID-19 press conference without me reminding everyone to remember their PPE, which is pandemic precautions every day. It's those simple everyday things like wearing a mask fully over your nose and your mouth, washing your hands diligently, physical distancing when possible, every day that we continue to take these pandemic precautions is another day that we continue to gain control over the virus. As I mentioned at the last press conference on Thursday, we had a city council meeting today. We approved several programs to provide financial relief for our local businesses. First, we approved a program to provide retail and consumer service businesses located in the downtown CRA with rent subsidies up to $5,000 per month for 6 months. We also amended our annual funding agreements with our 10 Main Street districts and their businesses by reducing the required match that these districts have to raise. It's our continued hope that our efforts will provide much needed assistance to our local businesses. Also want to remind everybody about the census. We're only at about 60%, so we need to drive that message home. It makes a big difference in funding formulas for both the state and federal government funding. And we continue to do testing. Wednesday we'll be at the Englewood Neighborhood Center from 9 to 1. You can make an appointment at orlando.gov/COVID-19. Dr. Pino?
Thank you, Mayor. Good afternoon. Before I talk about the COVID-19 numbers, I would like to announce that starting now, people in Orange County can request free HIV testing from their homes. It will be mailed to them. It's a self-administered test, and all the explanations on what to do will be in the test. And the web address to acquire a test if you would like to be tested or any family member is www.talktestc, as in Central, Florida, FL. So talktestcfl.com, and you can request a self-testing kit, and it would be for free. With regard to the other pandemic, the one that is raging right now recently for the last 8 months, we have continued to be at a positive recovery rate of 96%. The mayor mentioned the number of individuals that have been tested and the number of diagnoses that we have. And also, I would like to mention that 16 fatalities has been added to our list since we talked to you last Friday. But also, all those fatalities happened before Friday. So they were just later reported to us. And some of them, the time of the fatality extends from July to September. So there are some deaths that were reported late to us. And this could complicate things, but I'm going to say for those who want full transparency, I'm following the number closely in case that you see some discrepancy. 2 of the previous deaths that were listed were removed from Orange County after analysis so that they were not Orange County residents. And 1 death was added after the board, that is, the dashboard was updated. So the numbers could be a little bit off. But those are the reasons. Those who passed away were 4 females, 12 males, and the age range was from 56 to 97 years old. Of course, our prayers and thoughts with their families and friends. And also, we would like to speak a little bit about super spreading events. As the pandemic is continue to be under control in our county, there are some activities that are increasing, and we have seen a tendency to have family gatherings and other groups, and the spread of the virus continue to rage in through these type of gatherings. So it is important to refrain from more than 10 people if you can, have social distancing in place, clean the surfaces as often as you can, wear your mask, and wash your hands. And even because you are home, it doesn't mean that the virus doesn't go there. And as Mayor Demings said in the press conference, in the call the other day, if the virus got into the White House, it can get into any house. So we should be careful. We also are planning several flu shots events for our community. We normally do one a year for our practice run for this type of events. But this year we are going to do 3. They will be free, and it's going to be, and we will announce, but it will be October 17 on Freedom High School, November 7 to be determined, more likely Jones High School, and November 14th at the Colonial Promenade Mall in East Colonial Drive. With that, I pass it to Controller Diamond.
Thank you, Dr. Pino. For the month of August, our tourist development tax collections were $5,787,000. That is a 71% decrease from August of 2019. Although our collections increased from our July collections, we're still about 71% down, as I mentioned, and at historic low levels. As you'll see on the chart overhead, that'll show our progression. The low point in red is April this year when we were less than $1 million, and we've increased in May. We about doubled in June. We about doubled again in July. And this month, the collections are starting to, they're still increasing, but they're starting to plateau a little bit as well. And you can see the collections are still only about a quarter of what they were last year and earlier this year at our high points. Just a couple of comments I'd like to add. Looking forward to September's collections. There certainly are signs of a continued incremental recovery, as well as significant uncertainties. Occupancy rates rose to about 50% over the long Labor Day weekend, but room inventories were down by about 25% due to hotel-motel closures, and average room rates also fell during that time. Our area's unemployment rates are still Florida's highest, with thousands of tourism-related workers laid off or still on extended furloughs. One encouraging trend has been the relatively low COVID-19 positivity rate and number of cases. And there have been no reported instances of virus outbreaks at the theme parks due to county and tourism industry safety measures. This all bodes very well for the recovery of the tourism industry. However, the state has just entered phase 3 of reopening, which will essentially lift most restrictions. So there is uncertainty about what impact this will have on these positive trends. On the expenditure side, the county continues to use TDT reserves to offset ongoing TDT collection shortfalls and meet funding obligations. And while reserves are still at a healthy level, it's important to continue to reduce the drawdowns given the uncertainty of when the tourism industry will recover. Reserves decreased by $14.9 million in August. All that said, Mayor Demings' decision to suspend or cancel all contracts connected to the convention center expansion projects and defer other payments has already helped decrease the drawdown of reserves. We will release our September TDT collections report in early November. So with that, I'll pass it over to Mayor Demings.
Okay, so hopefully in the middle of all of that, there was some encouraging news, some bad news, some good news there. Any questions that you have at this time?
Well, since Lauren Seabrook's not here, I'll take the honors of the first question. This one actually is for Mr. Diamond. Phil, you said that there were some encouraging signs. What are they?
Well, I think the encouraging signs, number one, Labor Day was a big deal. I think it was Universal actually closed the park or stopped selling tickets. I think the good news about the COVID virus is good news, and people will be more likely to come visit here if they feel safe. And I think lower positivity rates and lower numbers of cases send the message that they can be safe. So I think those are good signs, and hopefully people will continue to wear masks, people will continue to do all the things to stay healthy, not just because it keeps them healthy, it helps the economy, and it'll help people get back to work.
Mayor, when you look at the CARES Act funding, will any of those theme park workers, like the furloughed from Disney, will they get to move to the top of the list for that funding since they were hit so hard and so many of them?
It'll be very difficult for us to be able to do that because there are many other employers who have permanent furloughs as well. So I don't think we can get in the business of prioritizing who has the greatest need. So it'll be first come, first served basis, but we'll open it up, as I indicated, to the first 10,000. We'll process them, and then we'll open it up for an additional 10,000 for a combined total of $30 million that we intend to make available.
Eric Sandoval with News 6. I actually have a question for Dr. Pino. I asked Alvina Chu about this last week, and I just want to get your sense of it, and you brought it up this afternoon. Some of the deaths being reported now are from July. I know our cohorts in Miami were reporting last week that some of their deaths were, backlogged several weeks as well. What is causing this backlog and delay in reporting the number of deaths? And what kind of confidence does it give you in giving you a clear snapshot of what exactly is happening?
So each case is a little bit different, but what we have seen when we go into these cases and look for it, for example, one that we went into details last week because it was also from July, the person died at home in that case, for example. So that makes a mandatory autopsy if you die at home. So there's also a number of cases that had to be certified by the medical examiner. So that adds to the waiting because you have to be, you get into a queue for that type of procedure. And then the certificate of this case was filed 10 days after. And then 12 days after the certificate was filed, it was reported to the state and then reported to us. So this is just one case. But in every single case, what we have seen is some type of delay. Now, in some of the cases that we saw in the past, they were also due to the fact that we received, between the two latest data dumps, about 600 new positive cases a couple of weeks ago. Some of those cases were there. So after you get a result like that, then the certificate has to be reviewed because now you have a positive test. So each case is a little bit different. It's not about confidence on the data. It's that sometimes, because of these delays, it can give the impression that there has been some data manipulation, which it isn't. It's just a fact that they get reported later than expected. But it will be most accurate for us to have the information as close as reality as possible so that that can have an impact on the type of decision. But the fact that we know that is happening so we can control for it, meaning, for example, we got all these cases. So the first question is, okay, when they die, are these all cases? And what happened in the oldest cases, so that we are sure that we are not artificially taking in consideration a decrease in the death rate that has not happened. But the case is that it had happened.
Emily Braun from News 13. This question's for Mayor Dyer. It's about the Small Business Rental Assistance Program. Can you go over the eligibility requirements that a business needs to meet to apply, and also why specifically focus on downtown businesses?
The answer to the first question is the same. The geographic area is the CRA, and it's CRA funding that we're using to do it, so it's only available for those businesses that are in the CRA. So you need to be a small business, and we define that as 50 employees or less. You need to be in the CRA, and then you're eligible for up to $5,000. You can't be more than 45 days in arrears on your rent, and your landlord has to be agreeable to matching the up to $5,000 with either a deferral or a reduction in your rent.
Kelsey Thord with West 2 News. This question's for Dr. Pino. Sorry to pull you. You said earlier, that you were kind of alluding to the fact that the president tested positive, saying if this virus can get into the White House, it could get into any house. We are also now seeing that the president is leaving the hospital, and he's tweeting out that, he don't be afraid of COVID, don't let it dominate your life. Do you agree with that, or what would you tell to people that are seeing the way the president is acting?
Well, I don't have an opinion about the president itself. With regard to the virus, it is to be worried about it. When someone can die, you should be worried about it. But I agree that we should not let it dominate our lives. We have to learn how to live with it, which is different. The difference is we have to take into consideration what are the steps that we have to take to prevent this from happening as we go and try to establish a normalcy in our lives. And a good example of that, let's say, is sporting events. Can we have them? Yes, we probably can have them, but it cannot be what we had before. Standing ovations, people close to each other, yelling and screaming. That cannot happen. It would be a super, super spreading event, as we have seen it. But the idea that we should not be afraid, I don't know if the word is being afraid or not of the virus, but we should be conscious of it because it's serious, and it has killed close to 500 people in our county.
This next question was texted from Lara Greenberg with Fox 35. I believe this one is geared towards Mayor Demings and Dr. Pino. Her question reads, with Cocoa Beach lifting its mask mandate and numbers continuing to improve, is there discussion about lifting the mandate here in Orange County?
The short answer to the question is yes, we have discussions about whether it's an appropriate time to lift the facial covering order at this point in Orange County. And when we put our collective minds together, those who are in the field of research and medical science and those of us who work in the public sector to keep the people safe, we have a mutual agreement that now is not the time for us to relax on wearing facial coverings in our county.
Additionally, she writes, we've noticed downtown over the weekend really big crowds at the bars, very few masks, no social distancing. Who's monitoring them, and do you have any concerns about spikes in safety at bars? Are you seeing an increase in numbers stemming from people at bars?
I'll let Dr. Pino respond to the question about whether or not he's seeing spikes, but I believe that it I think has dual responsibility. Those bar owners or managers have a responsibility to make sure that they are embodying the CDC guidelines that have been put in place. And then there's individual responsibility as well. It's up to you whether or not you wear a mask in those settings. If I were the patron, I wouldn't patronize a location that wasn't following the CDC guidelines. Dr. Pino?
So we have not seen an increase, but from the experience last time that the bars opened, that could be happening next week. It happens about 3 or 4 weeks after. But the virus will not magically disappear and wash off our shorelines. It's there, and it just takes one asymptomatic person to be there, to transmit it to a few, and it will go again. So the advice to all those establishments is that as the mayor said, they also have a responsibility to protect our community.
And this last question was texted in from Ryan Lynch for Phil Diamond. Ryan Lynch with the Orlando Business Journal is asking, what kind of expectations do you have for tourist tax collections through the end of the year, and what might that look like?
Well, it's always hard to predict, and today we talked about August collections, and next month will be September. And in September, we had a very good Labor Day, and even though that's historically a good day, hopefully that continues again. Also, there are some trends with virtual schooling that some people may be traveling with their kids, since their kids can take virtual school wherever they are. I don't know how much of that is going on, but hopefully, if they choose to travel, they'll choose to travel here. As far as the rest of the year, I think it's a little bit too early to tell. I think you've got, there's been talk about a vaccine. There's been talk about where the economy's going to go. So I think right now probably the best thing to do is take it month by month.
Okay, if there are no other questions, if there's any Spanish-speaking media who are here, we do have Commissioner Gomez-Cordero, who's present, who can speak to you in Spanish, as well as Dr. Pino, and Ms. Carol Palacio, one of our assistants, is here as well. So with that, thank you all for being here today.